Hello, everyone, and welcome to McGill Cares, a weekly webcast series addressing a wide variety of topics to support family and informal caregivers. I'm Claire Webster, a former caregiver who became a certified dementia care consultant and founder of the McGill University Dementia Education Program. I work with a dynamic team of leading healthcare professionals to oversee this program, which include Dr. José Moret from the Division of Geriatric Medicine, Dr. Serge Gauthier, McGill University Research Center for Studies in Aging, and Dr. Gerald Fried, McGill Steinberg Center for Simulation and Interactive Learning. These webcasts are made possible thanks to the generosity of our donors, and I would like to thank the Lindsay Memorial Foundation for sponsoring today's webcast. So we're going to be featuring a topic that I truly believe does not get enough awareness. It is called Understanding Autism Spectrum Disorders. Just like dementia, I've often had family members reach out to me and say, when my child is diagnosed with autism, I don't get any information or enough information. There's no prescription of care that is provided to me as a family member. And so I decided that I thought it would be an important topic to highlight. My guest today is Julie Scorah, PhD, Assistant Professor in the Department of Neurology and Neurosurgery in the Faculty of Medicine and Health Sciences at McGill University, and Associate Director of the Azrieli Centre for Autism Research. Dr. Scorah is a neuropsychologist whose areas of expertise include the assessment and diagnosis of neurodevelopmental disorders, particularly Autism Spectrum Disorder, Attention Deficit Hyperactivity Disorder, and Fetal Alcohol Spectrum Disorder. Welcome to our webcast.
Thank you for having me.
Well, I'm very excited to interview you today because it's going to be a true learning experience for me as well. And as I mentioned, in my introduction, I often have friends who come to me and say, Claire, would you please do a webcast on, autism? Because there really isn't enough information. Why is that?
It's a very prevalent condition. So you would think that there would be more. I think that probably there's a lot of information that's out there, but not all of it is accurate. So I think that's probably the biggest problem with autism is that you can find almost anything on the internet, but only a small amount of it is accurate, evidence-based information.
All right, so I'm going to start by the big question, which is, what is autism spectrum disorder? Mm-hmm. What are the early symptoms? And also, if you can kind of differentiate between autism and ADHD.
Sure. So autism and ADHD are both neurodevelopmental conditions, which means they're present in the early childhood period, and they involve the way that your brain develops. Autism itself is characterized by deficits or impairments in two main domains of functioning, one being social, the other being behavioral. So you see difficulties with social interaction and social communication types of behaviors. You also see difficulties with repetitive and restricted and stereotyped patterns of behaviors and interests. ADHD, in contrast, is a disorder that's characterized by deficits with attention, and often you have symptoms of hyperactivity or impulsivity as well. So it's different spheres of development that are affected, but many people with autism also do have ADHD as well. The early signs of autism are things like decreases in social behaviors like response to name, joint attention, using gestures to communicate, like waving by or pointing to things like you would see in typically developing infants. And usually those symptoms start to appear between 6 to 12 months, with most parents noticing them around 12 months. 12 to 18 months is when parents usually notice those symptoms.
Could people become diagnosed later in life with both disorders?
Absolutely. So most people that are diagnosed with autism usually are diagnosed around the age of 4 at this point. They can be diagnosed younger, certainly, but many people who have not been diagnosed at a young age and, over time did have some difficulties, sometimes in school or with social relationships. Sometimes they do get diagnosed as teenagers or as adults. ADHD is usually not diagnosed before the age of 5 because so many preschool age children, toddlers themselves, can be hyperactive, can have difficulties with attention. It can be hard to see which of those kids are going to grow out of those versus which of those are going to persist. So usually when you see kids start school, kindergarten, grade 1, and they're not able to sit and attend and stay seated at their desk and pay attention in class, that's when those kids tend to get diagnosed with ADHD.
And what are some of the common myths about autism spectrum disorder?
There's actually so many misconceptions about autism. It's hard to kind of answer with just one or two. I think the number one thing is that autism looks a certain way. A lot of people have an idea in their mind of what they think somebody with autism looks like in terms of, usually they picture it as somebody with significant difficulties with socialization, isolating themselves, having severe behavior. And really, that's not at all what many people on the spectrum are like. There really is a very wide range of symptoms, a wide range of abilities. Not all people with autism have intellectual or cognitive disabilities, for example. So some people just have an idea about autism that it looks a certain way, but really many people with autism can be very, very similar to people without, and you wouldn't necessarily know.
And are there different stages of the disorder? I mean, are there some cases where there's more challenging behavior? And also, does it evolve over time? Because when the person is mostly diagnosed, they're a child, but as they get older, does it evolve? So what does that look like?
Mm-hmm. Certainly, there are some individuals who have more severe symptoms than others. Some people have significant behavioral issues, some people don't. So certainly there are differences between people. And then within people, often behavioral symptoms do decrease over time. So, quite often, as is true with many preschoolers, behavioral challenges are there. But they can be a little bit more pronounced with preschoolers or young children with autism. But as they grow, those tend to decrease. And certainly we know that there are certain things that predict better outcomes. So people who have stronger cognitive skills, people who have stronger language skills, and people who've had intensive early intervention tend to do a lot better, and their symptoms do decrease quite a bit over time. So you can see big changes if those things are in place.
And how is a diagnosis made? And also, so what type of doctor should people be going to see?
Mm-hmm. A diagnosis can be made by a pediatrician, by a psychiatrist, or by a psychologist. Usually those are the three individuals that would be giving this diagnosis. Usually it's recommended that somebody be diagnosed by a multidisciplinary team so that they can get assessments by different individuals to look at different areas of development. There's no single early sign of autism, and there's no single profile. So really, it takes somebody who's specialized in the diagnosis of autism to be able to do that, because the diagnosis is really based on looking at behaviors. There's no biomarkers, and there's no blood tests. There's nothing like that. So it's really a person, a clinician who can use their clinical judgment to look at their presentation of symptoms and the behaviors that they're observing and be able to fit that pattern to the diagnosis.
So will parents require really like a multidisciplinary team of professionals? I mean, will they, for instance, require, a speech therapist to get involved? Will they require, a psychological support? Like in general, to manage this disorder, will they need a team?
Usually, yes. Again, people with this diagnosis can be quite different from each other. So it really does depend on the needs of the particular person. Some people, have greater needs than others in some of these different areas, but typically some form of speech and language therapy can be useful. Occupational therapy is often included because there's often sensory issues or adaptive skills issues or difficulties with fine motor skills or daily living skills. And, quite often a psychologist can be helpful too, because there's often behavioral challenges. Usually it does require a team of professionals to treat all the different spheres of development that are affected.
So let's talk about treatments. What treatments are available, let's say pharmaceutical and non-pharmaceutical, not only for autism, but also for ADHD?
Mm-hmm. So in terms of pharmaceutical treatments, for autism, there's no pharmaceutical treatments right now that have been developed that can treat the core symptoms of autism. But there are people who do take medications to treat some of the co-occurring symptoms. So quite often, as I said, some people with autism do also have ADHD. ADHD has been treated for many years with medication. So that's something that, if you have ADHD symptoms, psychostimulants and things like that can be pretty helpful. And people with autism often do take those when they have ADHD symptoms. Sometimes people with autism also take medication to help with severe behavioral difficulties, anxiety, depression, sleep issues. There's a whole bunch of other, comorbid issues that they might have that can be treated with medication. Aside from medication, for both ADHD and autism, behavioral treatment is also usually recommended. And behavioral treatments usually can be done either through the public healthcare system or the education system.
So can you describe, because, for, let's say, parents watching now who have young children who have autism, what would be some of the more challenging behaviors that could be displayed?
There's really a wide range. I think probably the most challenging behaviors is some people with this diagnosis will engage in self-harm type of behaviors. So they might do things like, biting themselves or scratching themselves. And those are usually, or banging their heads against objects. And those are usually the most distressing behaviors to parents, because obviously they don't want their child to get hurt. And quite often they're not sure how to respond to that and how to get their child to stop doing that. So those are usually, the most significant behaviors that we see. And of course, sometimes there can be some destructive behaviors or aggressive behaviors towards others, but I think parents are usually very concerned about the self-injury.
Okay. And can you maybe share some coping strategies then? Like if a parent finds themselves in a situation with a child who is, acting out in that certain way, what would be some good coping strategies to deal with it?
Well, it depends a bit on the specific behavior. So, obviously the number one thing is always making sure that the child is safe and that others are safe. And sometimes it's okay after you've assured that to let the child, have their meltdown, and then everybody cools down, and then you can do something constructive to deal with it. It can be really hard to know how to intervene in moments when a child is having a meltdown, because usually that's not a time when they're very reachable or teachable. So, quite often I tell parents, just make sure your child is safe, let them work through it, let them have their meltdown, and then you can do things to repair the situation.
Now, in general, children that are diagnosed with autism, or even let's say, more advanced forms of ADHD, can they attend like regular school, regular classes, or will they require like a shadow or support?
So again, this really depends on the child. There are many people with a diagnosis of autism who are in regular classrooms and don't have an aide or a shadow helping them, and they're doing just fine. There are other kids who are integrated into regular classrooms and they do have an aide, and that, aide could be part-time or full-time. And then there are children who don't really do so well with being integrated in the classroom because they need a little bit more support. And so being in a specialized classroom might be a better fit for them. And then, there are specialized classrooms within regular schools, and there's also specialized schools as well. So, it's really about finding the best fit for each child depending on what their needs are.
Okay. And so what would be the most important things that a parent learning that their child is on the autism spectrum would need to know in order to plan for their future? So I'm the parent, I'm like now in your office, I've just received the diagnosis. What do I need to do and how do I plan?
Mm-hmm. I would say, educating yourself about autism and about the, treatments and services that are available is very important. Being a good advocate for your child and getting involved in their treatment. So we know that when parents are involved in intervention, that usually means better outcomes. So parents can do a lot to help their child's development move forward. So getting involved and advocating for what their child needs, I think is probably the number one role to play, because there aren't a ton of services out there for everybody. And so it is important to really push for what your child needs and advocate for the help that they need.
Now, just like, caring for, a loved one who has other forms of neurocognitive disorder, it takes a tremendous amount of energy. I think one of the challenges probably because, in many families, they have more than one child. So they're putting a lot of energy towards this one child. Like what I hear from some of my friends is, this one child takes up a lot of our energy, and then the other children start to feel like they're not getting the attention that they feel they also deserve. So how can families cope? How do people cope as a family with this disorder?
Yeah, that's a really good question. Siblings often do get involved and implicated in caregiving, and some siblings I've seen have become little interventionists themselves, and they learn how to do therapy. But at the same time, it can be difficult to have a sibling who you feel is getting more attention than you. So I think it's important for families to, first of all, self-care is very important as caregivers. So making sure that, as tough as it is, try to find ways to engage in self-care so that you have the energy to care for your kids. And finding ways that also that siblings can have their own special time and their own activities, separate from their siblings too, so that each of them feels like they're getting attention. And that can be really, really hard and really challenging when one child just, has many hours of therapy that they need to have. It's really a situation where I think it can be very helpful if you have a support network to call on family members and friends to help you out, which of course is extremely difficult right now because of the situation that we're in. And many families are struggling with that they don't have the network that they usually would have to be able to provide care for their kids.
So what are the support services that exist right now? Like if we talk, let's start by maybe talking about Montreal, and then let's talk from for people that are very good on the web, like what would be some really good, national or international sites that people can go to?
Mm-hmm. Well, so most of the services that exist come either through, and I'm talking about public system services
Yes.
at this point. So they come either through the healthcare system or through the education system. So in the healthcare system, once your child has a diagnosis, it's important to get hooked up with your CUS, with the CLSC, to get a social worker. And there are designated treatment centers for people with autism where they have specific types of behavioral therapies. Quite often, the intensive behavioral therapies stop at age 6, and then after that, the children would get their services mostly through the school system. So those are the two main places for people to get services. And in the healthcare system, the CLSCs and those types of centers can provide other types of services and support over a person's lifespan as well, like respite services and things like that. And then, of course, outside of that, there's the private system, which isn't accessible to everybody, but there are services available privately for people who are looking for that. And other types of resources would include, things like summer camps or day programs, or even, therapy dogs. There's all kinds of things out there that families can take advantage of, and that really depend on their own specific needs. So a good place to go in Montreal is, Autism Montreal, to kind of look for what's available in terms of services and support groups and things like that. And then at a national level, there's not a lot of national organizations, but there is Autism Speaks Canada that you could go and take a look to see, what's available in a Canadian context. But services do differ quite a bit between provinces.
And as a result of COVID now, it's had an impact on everything, especially the healthcare system. Are there any virtual support groups that people could participate in right now, like especially for parents that you're aware of?
I'm not aware of everything that's going on in that sphere, I'll be honest. But there are, I do know that there are some, and I would say that going to Autism Montreal would be the best way to find out about that. And I also believe that there are some Facebook groups and things like that as well, that parents can go and get information and connect with other parents. Unfortunately, I don't think there's as much as there needs to be, though.
So would you agree that becoming as educated as possible about autism and seeking out those support services like as early as possible would be like probably one of the best ways to support yourselves and support your loved ones?
Absolutely, yeah. I think educating yourself, finding out what's out there, being an advocate, those are all essential, and good self-care as well. Very, very important.
Well, thank you so much for taking the time to be with us today. And I'll make sure that if you could send me some links, we can post some more information about those websites that you mentioned, and we'll have it on our website in our resources section for people. Yeah. Well, thank you so much for taking the time today.
Thank you so much for having me.
So please join me on Wednesday, February 10th. The topic will be language and communication with persons living with dementia. My guest will be Noémie Auclair-Wallet, speech language pathologist and professor at the School of Communication Sciences and Disorders at the McGill Faculty of Medicine and Health Sciences. She works with people living with mild cognitive impairment and dementia, as well as those with aphasia following a stroke. She will speak about the types of changes in the ability to communicate that a person with dementia might experience, interventions that can help retain the ability to use language, and the best ways to support conversation with a person with dementia. This webcast is an initiative of the McGill Dementia Education Program, which is funded by private donations. Once again, I'd like to thank the Lindsay Memorial Foundation for supporting today's webcast. If you would like to make a contribution to our program or for more information, please visit us at mcgill.ca/dementia. And if you have any specific topics or questions that you would like us to address, please email us at dementia@mcgill.ca. Take good care of yourselves and your loved ones, and thank you for tuning in.